Good morning to you all. My name is Jennifer Matthews. I'm the Director General of the Department of Local Government and Communities. I'm delighted to be this morning to welcome you to the Age Friendly WA workshop, and it's wonderful to see so many people here at the workshop we're representatives from state government, a number of local governments, and of course a number of representatives from the community services sector. So it's wonderful to see you all here today working together on this most important topic. Today's workshop is a really unique opportunity for you and your agency to be part of what I think is really groundbreaking work happening here in WA in promoting and supporting age-friendly communities. And today's workshop is a really valuable forum for us to come together to hear about some of the wonderful examples of collaborative work that is going on in this area, and also to hear from some of the international and national best practice that came out of last week's International Federation on Ageing Conference in Brisbane. So I think there'll be a lot of very valuable learnings from today. The workshop today is an initiative of the Age-Friendly Interagency Group, called AFIG, because we're government, we like to have an acronym, which brings together a number, in fact 14 state government agencies, local government representatives, really to share information and develop collaborative responses to ageing within communities here in WA. AFIG is chaired and supported by the Department of Local Government and Communities, and really does provide that forum for people to come together and collaborate. And this recognises, and we'll hear a lot about this morning, it's so important that planning for the needs of older people and seniors within our communities is very much a shared responsibility. It is not something that can be addressed individually or by one agency. It's a shared responsibility which requires an integrated and coordinated approach, both in relation to policy development and service delivery. So this morning we're very fortunate to have some wonderful experts in this field to talk to us today and to share their insights and experiences in ageing and age-friendly planning. In particular, I'd like to acknowledge Dr. Jane Barrett, who's the Secretary General of the International Federation on Ageing and a global expert on age-friendly issues. And we're very privileged to have Dr. Barrett with us today to be talking to us as the keynote. Originally from Perth, so back in her hometown, but now based in Canada, Dr. Barrett has more than 35 years' experience in the field of public health, community and aged care, ageing and disability. And she's a very strong contributor to the international dialogue on the social, political, cultural and physical issues that impact on the lives of older people. So Dr. Barrett will be with us for the whole day and will be facilitating some of the workshops this afternoon. We're also very privileged to have with us local leaders in this area and in their respective fields who have shaped and contributed to Western Australia's response to ageing. And they are Christine Young, who is Chair of the Local Government Managers Association, WA Age Friendly Network. And Christine, through her work, particularly at the City of Melville, has done some really groundbreaking and I think trend-setting work in the area of age-friendly communities, particularly at the local government level. And I think it really does showcase what local government and the important role of local governments in this particular space in establishing really good place-based approaches to ageing within communities. We have Wendy Newman, who is the CEO of the Wheatbelt Development Commission. And again, Wendy is leading some really terrific work across the Wheatbelt in terms of some new and innovative approaches to ageing in the bush. So we'll hear a little bit about that today. Ian Carter, who is the CEO of Anglicare, who will be talking to us today as well with extensive experience in this and addressing other social issues. We have Dr. Karen MacArthur, Executive Director of the Southwest Metropolitan Partnership Forum, which is, again, another really great example of collective impact and collaborative approaches to quite complex social issues. And they've been doing some fantastic work and have recently won a couple of quite major awards for their work in this area. Jason Burton, General Manager of Alzheimer's WA, and we have Scott Hollingworth from the Department of Local Government and Communities, who will also be sharing with you the work that the department has been doing in this area. So look, through the day, we've got a full day. We will be having a range of individual speaker presentations in the morning up until lunchtime. We will be joined by the Minister for Local Government and Community Services, Seniors and Volunteering, the Honourable Tony Simpson. He will be joining us for lunch today, and so I know that he's looking forward to coming along and meeting you and talking with you. Just a bit of housekeeping. These presentations today are being recorded. We're really keen to be able to broadcast out these presentations and make them available, particularly into regional WA. We think that that's really important, that they have access to this. Also, a little bit of housekeeping. If you wouldn't mind just turning off your mobile phones, that would be very, very helpful. So look, with those sort of opening remarks, it's now my pleasure to invite our keynote speaker, Dr. Jane Barrett, to come to the stage and to give her presentation. So thank you.
Good morning. You know, I'm a Carlisle girl. I was born in Western Australia. I think it was at St Ives Hospital that doesn't exist anymore. And I grew up in Carlisle, just, not very far away. And never in my wildest dream as a child or a young adult or middle age would I have ever considered myself living in Canada. And it seems to me that what we're trying to do around Age Friendly is go from local to global. That's what we're trying to do. And I can tell you that the work that's happening in Western Australia is leading edge. But it's really difficult to try and take that message in when I'm a girl from Carlisle, Perth, Western Australia, one of the most isolated cities in the world. So my first message to you is, you are part of a model that is being recognised worldwide as a potential to be scaled up in many countries. And so I think it's important right at the beginning of this workshop to say, the stuff that you're doing is good, keep doing it. But we're also counting on, each of you as part of this model, to extend yourself to the next place. What I'm going to be talking about, can you all hear me? Yeah. What I'm going to be talking about, you want me to come over here? Okay. Sorry? Okay, all right. I can manage that. What I'm going to be talking about to begin with is something really new, and it's come out of the World Health Organization report, the first evidence-based report on ageing and health. And that was launched last year in September. Subsequent to that, the World Health Organization delivered their global strategy and plan, and 149 countries signed off to this plan. One of the priorities is age-friendly environment. So we know that Australia, as a member state of WHO, has to report against that priority. So the work that you're doing in Western Australia, not only is it leadership quality in Australia, it has the potential to be part of the change agents globally. So why? Why do we talk about age-friendly? The common response will be, there's a lot of older people, true? And we go through the stats every time. And we go through the stats around the prevalence of chronic conditions. And I think that's a good start because it's something that we feel really comfortable with, talking about numbers. So here are some numbers. What we know is that, now there's about 901 million older people in the world. It's a big number. I'm one of them. Some of you here are them too. We also know that by about 2050, there'll be 2.1 billion older people. So is that a good reason to look at age-friendly environments? Not necessarily. We also know that in Europe, 34% of the population are over the age of 60. So once again, they're big numbers. You know, when I was talking to the Minister yesterday and learning about the seniors card and all the different kind of concessions, you know, I actually shared with him the bottom line, Minister, is the dollar. Because there is this dialogue that constantly goes on about older people cost us a lot of money. That's the dialogue that goes on, isn't it? You know, then we say, and older people make a tremendous contribution to the community, and they do a lot of volunteer work, and the bottom line is that there is an economic burden. And so what we're talking about when we say age-friendly environments, we're talking about how to create an environment that enables older people to do what they value. That's what we're talking about. So it's not only the numbers that give us reason to think about how to enable older people to do what they value. Because if we're very lucky, we're going to hit 50 and 60 and 70. And if we're very lucky, we'll be hitting 80 and 90 with good health. So there's every likelihood that many of you here in the room today will hit 100. And some of you will be living independently and autonomously. Don't gasp, it's all right, it's okay. Just take a big deep breath. Huh? Because that's going to be the trend. You know, we know in Japan today, you know, there's over 70,000 people who are 100 years of age. Now, that's not a statistic to be concerned about. But what is necessary for us to be concerned about is the environment in which we create as policymakers, because each of you, in your own sense, is a policymaker. You have a dialogue that informs policy. So, much of what I'm going to talk about is based on the WHO report, and I'll give you a link. You know, there are 4 main priorities. There's a 5th priority, which is the first one that member states signed off to, and that was a commitment to healthy ageing. And I'm going to talk with you about the paradigm shift between active ageing and healthy ageing. But one of the key priorities, as you can see, is age-friendly environment. Now, what we talk about and have been since 2007 is age-friendly cities and communities. Well, then my argument to you would be that age-friendly cities and communities actually fits under the umbrella of an age-friendly environment. But we need to come back to some definitions, because when we actually understand a definition, it's much easier to hook onto what we're going to talk about today. So the definition of healthy ageing from the WHO is actually quite different than it was 10 years ago, and is process of developing and maintaining the functional ability that enables, and you'll hear this word constantly, enabling, capacity, capability, because the whole report and the thinking going forward is based on Amartya Sen's capability approach, which is quite different to the active ageing approach, which is based on social and behavioural determinants of health. So that's healthy ageing. So one word to remember, enable. But then we've actually got to understand what functional ability is, because we've talked about it here, maintaining functional ability. So there are 2 elements of functional ability. Functional ability comprises, you know, the health-related attributes that enable people to be and do what they value. So there's 2 aspects. There's intrinsic capacity, and then you have the environment. So when we talk about the intrinsic capacity, it's some of what we're born with, you know, so our genetics that we're born with, but also it's the lifestyle decisions that we've made across our life. You know, so the decisions around nutrition, the decisions around exercise, the decisions around smoking, the decisions around screening, that's the lifestyle decisions that are attributable to our intrinsic capacity. And then we have the environment, and that's the extrinsic. And there's one message I'd also like you to take away with, It's not about park benches. Park benches are very important, but let me tell you, that's not what it's about. It's not about traffic lights, and it's not about seats. It can be. You know, how do we understand respect in our environment? You know, talking with older people, and I talk with lots of them. You know, one gentleman said, I said, you know, what would make your life easier? To be part of community, what would it be? It would be very helpful if people could just talk a little bit slower. Pretty simple, but we don't get it. You know, so the automated machines actually are not age-friendly. You know, they're cost-effective, but anybody trying to get a different flight on Air Canada when one's been cancelled, forget it. It's not going to happen. So we've actually got to understand how to undo some of what we've seen to be efficiencies, because in fact they compromise the older people's ability to do what they value. So intrinsic capacity, environment, make functional ability, that is part of healthy ageing. Pretty simple. So this is just a slide that talks about the macro and the micro elements of the environment. So there are 3 common periods of intrinsic capacity in older age. And you'll recognise them very clearly. There's that period where you have high and stable capacity. So you're autonomous, you're independent, you're living, perhaps, you know, you're living by yourself, you're contributing to the community, you're volunteering, you're very active, cognitively and physically. And then there may be another period of declining capacity. You know, I'm not talking about age here, but we see a trajectory. And then there could be a third phase where there's a significant loss of capacity. But note I've said could be, because at every stage of these 3 phases, there are interventions. There are interventions that can actually help maintain our functional ability, and in some aspects actually improve our functional ability. So there is a myth that once you start declining, then you decline, full stop, and then... So this whole public health framework around healthy ageing is now talking about what is it? What are the interventions that we can introduce into community, into an individual's life that will actually help maintain or improve functional capacity? Because what do people want to really do in their older age? Most of them want to stay in their own home. But we've been very economical also in our language about accommodation. We have these things called ageing in home. Is that what you call them here? Age at home? Age in home? Ageing in place. Tell me what ageing in place means, because I've got not the faintest idea. Because what we tend to do is we tend to sort of truncate these to make it easier in our development of service policy. Ageing in place. I guess we're all ageing in place, aren't we? So it's about unpacking, you know, some of those terminologies and thinking about older people. Can anybody guess what the biggest barrier that older people face every single day of their life? It's ageism. It's the single biggest barrier. Ageism and age discrimination. If we could understand how to dissolve that, then access would be much easier. And being part of community and being valued as a contributor, a legitimate contributor to society, would be evident. All right, so this talks about the changes in intrinsic capacity over one's life. You can see different countries are reflected, And you can see certainly there's a trajectory going down. However, the characteristics in older age, and these would be most recognisable to all of you: movement, sensory functions, cognitive functions, sexuality, immune function, functions of this. So these are the underlying changes as we grow older. And of course, multimorbidities. But the other complexities are frailties, urinary continence, falls. But if I just take falls for a minute, you know, what we usually tend to look at when we're trying to understand falls, and as an OT way back, it's the rugs, the chairs, that's what I used to look for. But now in my job, I actually look for vision impairment, hearing impairment, poor nutrition, isolation, loneliness, which have contributed to. So, you know, we actually need to be thinking quite differently. This really is talking about the number of healthy life years, and the reason that I put it here is to really bring your attention to these conditions. So these conditions are really reflective of changes in healthy life years. So hearing loss, back and neck pain, diabetes, falls, depressive disorders. So, you know, we're actually looking at quite a spectrum of conditions that in the context of functional ability impact a person's ability to contribute. And each of these underlying conditions, with appropriate interventions, will lead to improvement in function and improvement in healthy life years. You know, it would be remiss for me to make comment about one of the most common and I think misunderstood conditions, and I acknowledge Rhonda Parker, CEO of Alzheimer's Western Australia, here today. You know, so not only are we dealing with, you know, massive increased prevalence, but I think we're also dealing with, you know, not being very clear in terms of an age-friendly environment, how to support and enable people with dementia to live in the most optimum conditions. And I know that Rhonda and Alzheimer's have been doing some work in in the development of dementia-friendly communities. So the burden of disease, 23% in 2008, that was the global burden of disease of people over the age of 60. So it's 1 in 4. This slide really speaks to the fact that it does matter where you're born and where you live in terms of healthy life expectancy. And so when we're creating age-friendly environments, it's really critical that we look at the socioeconomic advantages and disadvantages of the population. Because what we really need to be doing is perhaps examining, you know, outlying issues such as nutrition. You know, how do we get Meals on Wheels to people in rural and remote areas? And I'm delighted that Wendy Newman, I knew your last name, I couldn't remember. Yeah, Wendy Newman's going to be talking with us today, because there's a lot of work needs to be done in rural and remote areas, you know, globally. And there's only a few patches, Wendy, so I'd be very interested to talk with you afterwards to understand whether what you've been doing in the wheat belt can be scaled up, not only in Western Australia, but somewhere around the world. So in Lesotho, a young lad of 15 years of age has a 10% chance of reaching the age of 60. And a young boy in Sweden has got a 91% chance. And that's quite stark. And I think that, you know, if we think of Western Australia, you know, we could actually make some of the same predictions, probably not so stark. But this is the one that really affects me when I'm talking. So in downtown DC, Washington, the average life expectancy is 57. But if you get on a train and go 20 miles out, the average life expectancy is 77. So, within downtown DC, poverty, lack of education, poor literacy, no employment, generations of no employment result in an average life expectancy of 57. And we in Western Australia need to also remember, the inequities across our populations. I needed to put this up because most of you would have seen this active ageing policy framework, and that was really the underpinning of the 2007 domains, 8 domains that many of you would know of age-friendly cities and communities, and there they are. Right? Hands up those that have seen those before. Lots of you. Hands up those who haven't seen them before. I want big hands. I'm delighted that you haven't seen them, because I'll tell you why. This is only one part of the puzzle, right? Because when WHO were developing these, they were looking at the environment, from a very infrastructural perspective. And now what we're actually doing is understanding the relationship between intrinsic capacity and the environment. So it's the interplay between an older person and the environment that will give rise to functional ability towards healthy ageing. Right? So the periods of intrinsic capacity, I've said there are 3 likely phases, and there are interventions that can occur at any time. And that's what the environment is about. It's how can we use the environment to impact positively at those 3 phases in one's life. The WHO, in its report, actually have gone one step further, and they've talked about the domains of functional ability. And it's these domains that I want us to really take some thought with in our workshop, because we've actually got to understand from an individual perspective, how can we improve the function via the environmental impact? So, moving around, mobility, building and maintaining relationships. We know that isolation and marginalisation leads to anxiety, depression, loneliness. In Japan, their rate of elder suicide is increasing. And one of the reasons is because of the isolation and the change of urbanisation, the increase in urbanisation. Meeting basic needs, being able to do the shopping and personal hygiene. The ability, the continued ability to learn, grow and make decisions. How can an environment encourage older people to maintain that decision-making ability? And it's tough, but that's what age-friendly environments is all about. And obviously contributing. In Brisbane, there was the principal investigator from the Okinawan study. The Okinawan study is one of the longest. It's a longitudinal study that's been around for a long time. And so Bradley was talking with us about, why are Okinawans living longer? And yes, there are many aspects. It's the diet and the food. Anybody like sweet potato? Right? Sweet potato needs to be on your agenda every day, apparently. But one of the critical things that I heard was, and I can't remember the language that he used, but the translation was, being worthy of contributing every day, a purpose to get up in the morning. And we know this kind of stuff, but there's evidence, and it's really important that we actually take that most seriously, just as walking and talking and making decisions. This purpose in life, because that leads to healthy ageing. Right, this is really talking about the trajectories, the 3 different phases, and the evidence that suggests that interventions in any phase of that continuum will give rise to changes in functional ability. Really what we're talking about here is a person-fit environment. So although this is health, we can put this optimised trajectories of intrinsic capacity within our discussions around environment. Because if we go back to the park bench, which I will go to, the park bench, the height of the park bench, what does it do? It enables an older person with mobility problems to get up out of the park bench, and to walk. If the park benches, are at an adequate distance, it's walking and sitting. So what we're really doing in that is actually speaking to, the movement in the functional domains. So I just want to give you some examples of making sense of some evidence in the context of age-friendly. And one of them was a statement around the reasons for not accessing home health care services by country's income. And you can see, one of them is not affording the visit, but not affording transport. I'm really pleased that we've got people from the Department of Transport here. We need you. You're critical to the functional ability of older people. So thank you for being here. So sometimes it's transport. The priority pass card in Kuwait, this is a one-stop shop. This is an access card. And I was impressed yesterday to know of all of the opportunities that older people have with the seniors card. The discounts and the subsidies, etc. Does the senior card fit under an age-friendly environment? I work all over the world, and in some countries, there are the same problems, but the magnitude is almost immeasurable. So we have to do things in different ways. So one of our members, when I said to him that he said that he was going to develop more mobile clinics, and I said that was John Robert in Cameroon. And his mobile health clinic was a bicycle and a bag. That's his... And what he did was he actually gathered his friends, so they all had bicycles and bags so that they could go out and work with older people. The two things that they needed to work with older people on was to teach them how to clean out the piggeries because of the transfer infection, and the other key aspect was to teach them how to grow mushrooms because of the nutrition. So that in itself is creating an environment that enables older people to not only to contribute but actually be more healthy. Similarly, in Ghana, what's happening is that healthcare workers are actually taking on some of the roles of the paramedics, in vaccination, in assessing, all of the health needs and the service needs of older people on a regular basis, on a monthly basis. I just put this may not fit into any of our work today, but it's an issue that we don't often talk about, and it's oral health of older people. So we have oral health, we have vision health, we have adult vaccination. These are the wins. These are easy wins. So in our thinking today, what are the easy wins that you can actually develop an intervention within an age-friendly environment to support? Because one of those wins may actually help older people to contribute, to their community. We often talk about the economic and social burden of older people, but we're convinced, as I hope you will be by the end of the day, that with an investment, then older people will actually be able to continue to make a contribution to their families and society, but will be able to remain more healthy for a longer period of time. There's a statistic that sticks in my mind from many years, and that is that only 1 in 7 older people should ever go into any institutional residential care, which means that 6 out of 7 are in the community. Now, if 6 out of 7 are in the community, how can the environment support them? I think I've given you the tip that we, IFA, as well as WHO, strongly believe that one of the most significant and intransigent barriers to helping improve the function of older people is ageism. And I'd like us to have this discussion during the course of the day because the WHO on the 1st of October this year will be launching a global campaign on ageism. And there's no reason why this group, you know, the interagency group on age friendly, or perhaps, you know, the Minister's Office, the department, could think about how they could contribute to a global campaign. And finally, this is my final slide, and then I'd love to have some questions. You know, negative attitudes influence decision making. So it's what we have in communicating with one another can create the opportunity for change. You know, if we truly believe that by creating an environment that enables older people to do what they value, not what we think that they should be doing, you know, then the community of older people will aspire to contribute not only to their family and their community, you know, but to their state. I'll go back and start saying that, you know, I was born in Western Australia. It's a great pleasure always to be back here. And it's been 14 years now that I've been in Canada. And, you know, always when I fly into Perth, you get that sort of, you know, pang of, you know, I'm home. And I'll always be an Australian, and I'll always be from Perth. But in my work, I have an opportunity to share information from around the world. But you have the opportunity to share what you're doing in Western Australia globally. So I really hope you take that opportunity because you are one of the leaders. And perhaps we hide our goodies under the bushel. Well, it's time that we chose not to do that. So thank you very much, and I look forward to talking with you during the day. Yeah, I'm happy to take some questions.
Good morning, I'm Henrietta from Umbrella Multicultural Community Care, and we are working with CALD and LGBTI elderly. So my question is to you, if you could tell us, in this publication from WHO, is there any mention of the special needs groups? Because we have an Aged Care Act that actually mention these special needs groups, and they do have separate needs. And in fact, in WA, we are the most multicultural state because by 2016, we have 1 in 5 elderly will be from a CALD background, and I'm not even talking about LGBTI, which is 10% of the population. So it's a growing number, and neither the previous framework or currently I'm seeing anything that could address their needs, and it's a growing issue. They have different needs and special needs. So thank you.
Yeah, look, that's a great question. So I think the first thing is we need to not see the 8 domains or the functional domains as prescriptive, right? That's the first thing. There are no rules in this age-friendly environment stuff, right? So I think, as I've said in Canada, you know, this is your opportunity to create what works in the CALD and the LGBT. Now, the report does make a lot of mention to diversity, but we really we don't understand well in terms of migration, and that's happening at a rapid rate, how to actually enable older people in different ethnic groups to live healthily. You know, there's a lot of work being done in Canada, you know, because of their diversity, and I'm very happy as IFA to make those connections and also to go back to WHO and ask them what's happening. And that's one of my roles here too today. So if you have a question and I cannot answer it, then I'll take that on board and come back to you. The other area, LGBT This is another area that was made mention in the World Report. But IFA has actually seen this area as an area that we have to pay particular attention to. So we have a global conference in Canada in 2018, and one of the sub-themes is on addressing inequity. That's the title, and within that title, you know, we have migrants, refugees, homeless, prisoners, and people from the LGBT community, because they're not being addressed, you know, from a global perspective. So I'd be happy to send you information about that. But make your mark, because when there's a gap, then there's an opportunity. So it's time for you to make your mark. Thank you. Any other questions? That was easy. Oh, Scott.
Yes, thank you. Scott Hollingworth, Department of Local Government and Communities. New York and Manchester are often held up as examples of world-leading work in this space. Knowing Western Australia as you do, are there particular things that we should be drawing from them, learning from them, introducing? I'd just like your reflections, please.
What you can learn from New York and Manchester is how to promote yourself. You know, I think we have done this very badly in Western Australia. And, you know, I really need to pay tribute to Christine Young, because, you know, Christine has sort of, you know, held the baton up, you know, in the early stages. And that's been building. And, you know, I think New York are doing some good work, have done some good work, but there is no recent work. Right? So I think that's important. Manchester certainly are continuing, and they have a model that, you know, links municipalities, but they don't know how to scale it up. Now, if you think how big the state of Western Australia is and the reach that potentially is in this room, you've scaled a country. And so it's really important, as I shared with the Minister yesterday, that, you know, we put some materials together and start promoting it globally, you know, what's happening in Western Australia. So I would hope that this model is written up, and perhaps it's written up in a referee journal, and that's one of the models that we could take to WHO. In next week, there will be a meeting in Kobe that I'll be attending around age-friendly environments. And I've promised the Minister that I will take something of what's happening as a model to there, you know, as a potential to, you know, a model of good practice. So we need to learn how to promote ourselves.
Hi Jane, Jerry Clay from the Independent Living Centre. My question was actually around the GATE initiative. So that's the Global Cooperation on Assistive Technology that WHO have prioritised recently. And I was interested in hearing your views from that very special place where you sit in terms of how you see that impacting on age-friendly environments in the future.
Thanks, Jerry. The problem that we have at WHO is that they're also siloed. So that initiative hasn't come to the light of Ageing and Health Department. And so if you know something, then we actually need to connect it into ageing and health, because they're probably, and my understanding would be, that they're actually running in parallel. Okay, so if you could share that with me, because one of the areas that the report talks about is technology, but one of the problems is that they have difficulty joining up their silos. You know, the same issue is with vaccines. So if you could share that with me, that would be great. Yes.
Marina Baldassar from the University of Western Australia. Just on that point about, thank you. Just on that point about technologies, is there more that you can say? My work is in the field of research on ageing and new media. Not so much assisted technologies in terms of disability, but in terms of connectivity and virtual community. So ageing in place, but recognising the role of distant carers, which is so important to a place like Perth, being so isolated. geographically, as you say. Is there more to say about technology and ageing from the report?
Yeah. Look, there's more to say, but there's more to do. And you would be aware of the very large consortiums in Europe that until a few days ago were, well funded. I'm not sure how well funded they are. That's a whole different, and we won't go with the US politics either. We'll just stay quiet here in Australia. So, there's very large consortiums going on in Europe around ageing and technology. Similarly, in Canada, there's the large consortium called Age Well. Are you aware of that one? Okay, I'll connect you up with them too. So the WHO talks about the application of technology, because if the emphasis is on enablement, what is it that we're doing in the environment that will enable somebody to communicate, across countries? So if we always think about in terms of functional ability and healthy ageing, then we understand where technology would fit in, or whether other communication, vehicles would fit in. I think one of the challenges in the whole area of technology is taking it to market. That's the biggest barrier, in being able to understand the impact of it. The other big area that, as a researcher you would know is the lack of evidence, the lack of measurement, around any of the interventions. And so one of the priorities was around measuring and monitoring over the next 5 years. This program of work is 15 years for WHO. The first 5 years that member states have signed off to is really to actually fill the gaps. And there'll be working groups related to the priorities, and I'm sure that it would be useful to be connected into that will actually respond to gaps in the evidence. Now, if they can collate the evidence and make sense of it within 5 years, it's likely that the member states from 2020 to 2030 will have what's called a decade of healthy ageing. So that's what the WHO are planning at the moment. And keeping in mind, this is the first time ever that ageing has been on the agenda. So this is landmark. So I'm very happy to connect you up with those colleagues and also WHO.
When you look at the way that the UK voted, it was very much a generational vote, and it was really interesting to see that split, and I'm wondering whether you feel, as I do, that it's maybe the start of older people really setting some significant policy. And we've been hearing for a long time about the critical mass of older people as they age, and how influential that's going to be in the world. And this seems to be really the first, I guess, significant policy change for a country based on an age-based vote.
Yeah, look, I think it's an interesting question and discussion, and I think there's a mixture of reasons, as we would know. I think one of them is around migration, refugees. That's one of the other areas. I do believe that it's important to look at the whole area of social contracts. I think we talk intergenerational, but I'm not sure whether we act intergenerationally. And it's not only about the contribution of generations, but it's also about dispelling some of the myths. And one of the myths that keeps being perpetrated is older people are taking the jobs of younger people. Well, we know that's not the case. So it's about how to understand the dynamics of the social milieus, amongst this chaos of migration. And so I'm, like many, waiting and seeing how this plays out. It would be helpful. I think I would feel more confident if the leaders knew what the next steps were.
Peter Kennedy from the Seniors Ministerial Advisory Council. You did make reference to only 1 in 7 older people should go to residential care. And I was just wondering how our record compares with similar countries, perhaps like Canada. Just how do we go in that regard?
And thank you, Peter. I think I know you too, don't I, Peter? From the television.
Yes, probably.
Yes, I think I grew up with you, Peter. Look, I have to say that whether we like it or not, Australia is still one of the leaders. in terms of the development and progression of understanding how to support older people in residential care. So we can be very proud of that. We're one of the only countries that has a national framework. So people in Western Australia will actually have the same access if they went to South Australia. That's not the case in Canada. Even within a province in Ontario, we do not have standards. If I go to Prince Edward Island, I will not get the same treatments or standards of care that I would in Ontario, because the jurisdictional responsibility is provincial. And so we still, are able to hold our heads up high. I think the rubber will hit the road. Yes, the rubber will hit the road, in the next 5 to 10 years, in understanding models that will support older people to maintain their autonomy and independence, as well as being cost effective. And it does come back to, the kind of health professionals and care workers and the cost of care, but also the way that we actually, understand the needs of older people. The Netherlands are doing some very fine work in long-term care. Long-term care, in the definitional sense globally, is our community care, our in-home, our community care, as well as residential care. So we're looking very closely, at the Netherlands, who are doing some pretty inspiring work there. So I'm happy to share that with you too. Okay. So thank you very much.
Thank you very much to Jane. It was a really informative presentation, particularly I think in terms of sharing what is happening, what is the latest international contemporary thinking on these issues, and I think we can really benefit from that, and that will help to inform our initiatives as we go forward. And we've certainly taken on the message about how we can work together to perhaps better profile and promote the wonderful work that we are doing in this state, particularly in terms of scalability, particularly when you think that WA is about the same size as Western Europe. So, there are some real things that we can share, I think, internationally. So I thank you. What we're going to do now, can we all join me in once again thanking Jane for her speech.